Hello, this is day 2 of my visit to Atlanta. Yesterday, we celebrated my son's birthday, and today we're going to celebrate my granddaughter's birthday when she wakes up from her nap. I want to talk about the preoperative visit. In my practice, the preoperative visit has become a pivotal point in the journey for a rewarding experience. If you think about it, during the original visit, we talk about the patient's interest, I examine the patient, and we give them choices of procedure that can be done. We give them a cost estimate. When they go home, they have to decide whether they want all the procedure we've talked about, when they want to have it done, and their financial situation. Then they call the office and say, I want X procedure done, and they work out the time. So during the preoperative visit, we're going to sit down and confirm the procedure that they wish to have done. We're going to go over the procedure again and answer all the questions. We're going to sit down and go over the preoperative preparation, what medications to avoid, how to prepare the night before the surgery. I am also going to review their medical history, their preoperative lab work, their medical clearance, to make sure that we do the procedure safely. We're going to talk about the recovery period, what they need to do, the importance of ambulation, management of the drain if there's going to be one. And we're going to talk about when they expect to go back to work. And lastly, we're going to go over the garment that they're going to wear. And if there is an implant involved, they're going to try the implant one more time to make sure that we are putting the implant they are interested in having. I will confirm in my examination that it is an acceptable implant. We also will talk about the insurance we purchase for patient should they have any medical issues after surgery that may not be covered by their personal insurance. Obviously, we have made every effort for such an event not to occur, but it is irresponsible not to think that sometimes issues can occur. In spite of the fact that the patient has been ambulating, they might still develop a blood clot in their leg. And if the patient has a high deductible, or if the insurance refuses to cover the diagnostic test, we still need to do them. And so that's why we purchase medical insurance for them. Obviously, it is not going to cover an unsatisfied patient, but it covers any medical issue that would occur secondary to the surgical procedure. Considering all what goes on in a preoperative visit, from discussion of the procedure to checking the size of the implant, going over the medical history, going over the procedure, the recovery, and the preparation, I'm not surprised that there is a certain element and a percentage of patients who go abroad to have surgery that are going to be unhappy with their experience.